still a disproportionate number of cases are African American, 44% of the new cases. And this just shows in terms of by HIV diagnosis by race, black, Hispanic, white. Among women again, we were talking about Rose College would have a congressional investigation trying to figure out what's going on. Now, this is one that's I think important in terms of lifetime risk of HIV diagnosis among black MSM and Latino MSM is 1 in 2 and 1 in 4. So if you have Latino MSM patients, the lifetime risk of if 4 patients sitting there, 1 of them should get HIV. A black patient, 1 in 2 should get HIV. I mean, the rate is that high. And I think it's that important for them to understand that. And again, that could be corrected simply by taking a PrEP to keep from getting infected. So look at the prevalence in the South.
Is PrEP still primarily Truvada?
Yeah.
Is there any
PrEP
other?
is Truvada. There's one
other?
study being done looking at the new Truvada, this COVID, but it is not approved for PrEP yet. WIlbert will have a drug out probably the latter part of this year, the first of next year. Don't know yet whether it's just going to be a pill or a shot for that. But the main one right now is the Truvada. And again, it's once a day. If the WIlbert drug works, it's going to be an injection every, we think, 3 months. They're still hush-hush about that. But it ain't no small shot, it's a big shot. I mean, it's like a simple shot, so.
Oh, really?
It's both hips, 2.5 cc, so.
Wow. Would that also translate into a treatment option?
Well, you need another drug.
As a drug for.
But you wouldn't use just that drug, you would need that plus something else if you're going to treat someone.
Sure.
But why would you want a shot?
No, I don't know. Yeah. Just
Some we have a young man came in yesterday. The kid is smart, one of the smartest patients we have, and we just sat there scratching our head. He has a nice family. All of his brothers and sisters have finished college, have careers doing things. Both of his parents are longshoremen. They worked. His father loved the hell out of him, but he just hooked on drugs. And he done take his med. And he came in. His T-cell count is 29.
Oh gosh.
And he just sat there talking about, I don't know why I just don't take my med. I know I got to, but I can't. And his primary, we've been doing this dance for 6-7 years now. Why won't you take the med? It's just hard to swallow the pill. He just eating a whole pizza. So I mean, it's just, we had a whole pizza, but it's hard to swallow the pill. You take crack, but it's hard to swallow the pill. I mean, it's like you have this one little compartment that doesn't cross over other part of your thinking process, because folks who do these other things should be able to take a pill. I mean, a half a pill is a pill. It's hard to get on a daily basis something less than 1 pill a day. I mean, you can talk about the size of it, but if it's going to open in your mouth, it's going to be 1 a day. Why? So you got to be dealing with something else that's going on that makes you not want to take it, as well as he hasn't seen what this caused in people before. Because like this kid, we had one last year, he ended up getting pneumocystis, and you couldn't get him off the respirator. But you got pneumocystis not because of the inevitability of HIV. He was selling he sold his meds for 6 years. Baby needs a new pair of shoes, this. So he sent me a note from the ICU saying you were right. I knew that 7 years ago. But you're gonna die now. They can't get you off. I mean, but his mother said, well, what are we gonna do now? What do you mean what we're gonna do? We need something to happen. Well, he wasn't supposed to be getting to stuff with his medicine. But I think that's still a problem with some patients. when you look at that. So you can see the ratio. The southeast is where we have a large number of cases, and there's many places in the southeast where there is no treatment at all, meaning no doctors treating at all. We're looking at trying to do telemedicine in those places. The brother study is one that looked, tried to get some demographic data on MSMs. They found 11% were previously diagnosed with HIV at baseline. And newly diagnosed included 3 with acute HIV, 12%. 30% self-identified as being gay or homosexual. And again, that's younger kids are more comfortable, but when you ask, if you come to my clinic, most of my patients will say, no, I'm not gay, period. So you know, which is why we say in MSM, have you had sex with a man? I say, yeah, but I'm not gay. And we're not gonna sit here and argue about whether it is or not. It's just that cultural vernacular is, don't call me gay in black vernacular really means I'm effeminate. So if I may say, without being taped, Little Richard is gay in terms of his actions. I ain't never seen him in bed, so I don't know who he's doing whatever with, so I can't say it. But you would say gay to someone who is really acting very, very effeminate. And surgery over 30. Many have been incarcerated. I have patients who go to jail to meet their partners. Going to jail is not an embarrassing thing. So I mean, I have patients, particularly a deacon in the church, they go to jail for some warrants. And you know, if I go to jail, but once I tell them my friend George is coming, in about 2, can we be roommates? So they'll save the room for George. So we can spend the weekend together, do whatever we're gonna do, and go home. Our wives never think anything of it. Not a big embarrassment that we were in jail. We can get up in church next Sunday and pray all over. So, and that's a problem. I mean, risk behavior really does not account for some of the, I think some of the bigger things or some of the cultural things that we have to deal with. Like men were less likely to have health insurance. Of all the patients we have had, young people who we bring in, when we bring them in, we have to then enroll them in insurance. I've only had one young person under 25 who walked in with an insurance. Everybody else, we had to enroll them in insurance. Even though it's out there, then